Good morning, girls. So hope you are writing the notes, preparing the notes properly. If at all you have any doubts, you can send the doubts by WhatsApp or you can call me. So this is one more topic in pharmacology, that is the 10th chapter. So one topic we completed, that is drugs used to treat eye disorders or eye diseases. Okay. So this is another topic on drugs used to treat skin infections. Okay. So first we will see the what is introduction. So introduction. The topical drugs are especially appropriate for diseases of the skin, and the dermatological diseases respond as well or better to drugs administered systemically. So systemically means by IV or IM or oral. Other variables that determine the response of topical drugs include these result variations in the drug penetration of the scrotum, face, axilla or scalp are far better permeable than the forearm. So these are the areas where the drug is quickly penetrating into the body than forearm. So that the areas are scrotum, face, axilla and scalp. Then regarding concentration, so when there is more concentration, then it increases the transfer of absorption of drug. Okay, so increasing the concentration increases the mass of drug transferred per unit time. Then dosing schedules. The skin acts as a reservoir, so the local half time may be the longer than the systemic half lives. So these half life time can be calculated based on this. Then vehicles. Vehicle is the through which it gets absorbed. So vehicle maximizes the skin permeability or penetration of the drug and their moisturizing and drying effects that they have therapeutic benefits. Then occlusion. So occlusion is nothing but application of a plastic wrap, and it increases the effective absorption and it maximizes the efficacy of the drug. So among these important skin drugs, the preparations includes keratolytics. So among these keratolytics also there are different types of keratolytics are there. We will discuss in after this introduction. So these topical keratolytics. These topical keratolytics are agents that are applied to the skin to soften the keratin. What is the keratin? Keratin is the material or the substance that is present on the skin. They loosen and assist exfoliation of the skin cells. Keratolytics also help the skin to bind moisture and is useful in treating dry skin conditions. They used to treat psoriasis, acne, warts, corns and other forms of keratosis. Moles and psoriasis, hives and eczema are just a few of more than 3,000 skin disorders known to dermatology. Changes in color, texture can result from inflammation, infection or allergic reactions anywhere on the body. Some skin conditions can be minor, temporary and easily treated, while others can be very serious and even life-threatening. And some very minor problems may be there which are temporarily easily treatable. Some may be chronic and long term or long course of treatment may be necessary, and some skin problems may be very much recurrent. But anyhow, these skin problems may be mostly handled with personal hygiene, good personal hygiene. Then coming to the definition of keratolytics. Pertaining to keratolytics, the softening and shedding of the horny outer layer of the skin It dissolves the intracellular substance and causes peeling of superficial layers of skin. So what are the catalytic agents? They are, the first one is salicylic acid. This you will be coming across this salicylic acid in combination with so many other combinations, and in many of these drugs may be containing salicylic acid. Then propylene glycol, then urea, then benzoyl peroxide, then tretinoin, then podophyllene resin. So the first one is salicylic acid. This medication is used to the skin to treat common skin and foot on the plantar surface of foot, which appear the warts. This salicylic acid helps to cause the wart to gradually peel off. This medication is also used to help to remove these corns and calluses. This product should not be used on the face or moles. Birthmarks are warts with hair growing from them, or genitals and anal warts. Salicylic acid is a keratolytic, and this is one type of catalytic, isn't it? So the list already we have seen. This salicylic acid belongs to the same class of drugs like aspirin. Aspirin is also again a combination of salicylates. It works by increasing the amount of moisture in the skin, and so mostly these when there is infections in some of the infections of skin, the skin becomes very dry. So these salicylate acts as moisturizer or moisturizing the skin, and dissolving the substances that cause the skin cells to stick together. So the pores will be opened actually. It makes it easier to shed the skin cells. So which are dried, which are dead, these skin cells will be shed off. Then warts are caused by a virus. Salicylic acid does not affect the virus. Salicylic acid produces desquamation of hyperkeratotic epithelium by dissolving the intracellular cement, which in turn causes cornified tissues to swell, soften, macerate, and desquamate. Salicylic acid is keratolytic at concentrations of 3 to 6%, and it is destructive to tissues at concentrations above 6%. Concentrations of 6 to 60% are used to remove the corns and warts, and in the treatment of psoriasis and other hyperkeratic disorders. Systemically, salicylic acid acts as non-steroidal anti-inflammatory agent with analgesic and anti-inflammatory and antipyretic actions similar to those of aspirin. Magnesium salicylate is taken orally for the treatment of pain and fever, and also in the management of inflammatory conditions. So these magnesium salicylate will be used in combination of other minerals, right? So here this magnesium salicylate will be used to treat any infections and other inflammatory diseases such as osteoarthritis. You know all these conditions you learned in orthopedic M.Sc also, medical surgical nursing. Okay. So osteoarthritis, rheumatic arthritis, bursitis, and other musculoskeletal disorders. So the next form is urea. So urea is used to treat dry and rough skin conditions. So this is also one form of keratolyte. These rough skin conditions like eczema, psoriasis, corns, callus, etc., and also nail problems. So especially in ingrowing nails, most of the girls or persons may be having these ingrowing nails. So they have to be given more care, because these ingrowing nails will cause damage of the tissues also. So it may also be used to help to remove dead tissues in some wounds to help wound healing. Urea is known as keratolytic, as we said earlier. It increases the moisture of the skin by softening or dissolving the horny substance that is called keratin. holding the top layers of the skin cells together. This effect helps to shed off the or fall off the dead skin cells and helps the skin to keep more watering, that is moisturing. In adults, the side effects are usually very few. It may occasionally cause skin irritation, and urea works in part by loosening dried skin. Preparations generally contain 5 to 50% urea. The urea preparations are emollients that are essential in the management of dry skin conditions. These emollients moisturizes the dry skin by reducing water loss from epidermis, that is outer layer of the skin. So it keeps continuous moisturing, and the cells will be intact, and reducing and it also helps in softening and more supple the skin. Urea works as hydratic effects, catalytic effects, regenerative skin protection, irritation and soothing effects, and penetrates and assisting penetration effects. That is, it helps to penetrate the medication. Okay. So how it acts as hydratic effect, that is, urea is strongly hydroscopic, that is, and it draws and retains the water within the skin cells. Then how it acts as catalytic, urea softens the horny layers, already we read about that. And regenerative skin protection, that is, urea has a direct protective effect against drying influences, and if used regularly improves the capacity of epidermal barriers for regeneration. Then irritation or soothing effects, that is, urea will act as antipruritic activity. And next, penetration, assisting the penetration, that is, urea can increase the penetration of corticosteroids as it increases the skin hydration. The next catalytic agent is propylene glycol. So this is a catalytic gel containing salicylic acid in propylene glycol. Again, see, salicylic acid is there. Then mixture of propylene glycol and water have been shown to be effective in several types of ichthyosis. Then a new formulation has been developed which contains a gelling agent, that is propylene glycol, ethanol and salicylic acid in distilled water. Derivatives of propylene glycol, 1 to 2 propanediol, and they are used as humectants and solvents in pharmaceutical preparations. A clear, colorless, viscous organic solvent and diluent used in pharmaceutical preparations. And this composition, the composition consists of a mixture of propylene glycol and urea. So these are the combinations. They are used pharmacologically. They are active, and the main components optionally in combination with lactic acid for the treatment of nails and skin disorders, and also with the further addition of glycerol and gel forming agents for the treatment of skin, as well as alcohol for the treatment of scalp. Okay. Then these propylene glycol is preferably used in concentrations between 40 to 80% by weight, and urea in concentrations between 5 to 20% and by weight, and also this lactic acid in amounts of up to 20% by weight, and glycerol up to 10% by weight. So the sentence is continued. Then coming to the lactic acid. This medication has two types of ingredients, emollients and catalytic, that works together to treat or prevent dry, rough, scaly, itchy skinning, as that is caused by eczema or keratosis or xerosis. This dry skin is caused by a loss of water in the upper layers of skin. These emollients are the substances that softens and moisturizes the skin and decrease itching and flaking. These emollients and moisturizers work by forming an oily layer on the top of the skin, and that traps water in the skin. These petrolatum or lanolin, mineral oil, and dimethoxy are the common emollients. Then these lactic acid and salicylic acid and urea are the keratolytics. They increase the moisture in the skin by softening and dissolving the horny substances, holding the top layer of the skin cells together. This helps the dead skin cells fall off and helps the skin keep more water in. Higher strengths of urea are also used to treat the corns, calces, and again nail problems. Urea is also used to help to remove dead tissues in some wounds to help wound healing. And this lactic acid exfoliates by losing the bonds between the dead skin cells and also to reveal a more radiant complexion. Lactic acid helps to keep the skin moisturizing and feeling less dry. When you use lactic acid regularly, it can also improve signs of aging, and it stimulates collagen renewal and can firm your skin. Hyperpigmentation fade and fine lines of fine fade and the fine lines will be cured and wrinkles will be softened and smoothed out. That is why the age factor will become, that is the wrinkles will be removed earlier. Then next comes sulfur. Sulfur is again, this is antifungal, antibacterial and catalytic activities. This sulfur used alone or in combination with the agents such as sodium sulfositamide or salicylic acid, and it has demonstrated efficacy in the treatment of many dermatological conditions. This sulfur and salicylic acid can also be used effectively to treat acne and cradle cap in some patients. Resorcinol is another keratolytic that is usually combined with sulfur. Urea acts as keratolytic due to its hygroscopic property. Sulfur helps to dry out the surfaces of skin to help absorb the excess oil, that is sebum, that can contribute to the acne breakouts. It also dries out the dead skin cells and help to unclog the pores, that is opening of the pores. Some products contain sulfur along with other acne fighting ingredients such as resorcinol. When sulfur gets intact with the skin, and most of it does not get into the bloodstream. However, it can be absorbed into the skin itself. Although this skin lightens, the products can reduce the dark skin hyperpigmentations. They can also create light spots, and they can darken the skin acne scars. These sulfur can help because it clears the dead skin and encourages the new skin cells to grow, and it is not as harsh as most skin lightness. So this sulfur is used for skin lightening, that is for glowing the skin. So most of these skin glowing creams contains sulfur. Then sunscreens. So ఇది మీకు చాలా అవసరం కదా, sunscreens అందరికీ, మీకే కాదు అందరికీ. So these sunscreens are used to protect the skin from the harmful effects of the sun. So they help to prevent sunburn and that is burning because of the sun, and premature aging as wrinkles and leathery skin. ముడతలు పడ్డమంటారు కదా, తొందరగా ముసలితనం కనిపిస్తుంది కదా, అలాంటివి రాకుండా చేస్తుంది ఈ సన్ స్క్రీన్. సో సన్ స్క్రీన్స్ ఆల్సో హెల్ప్ టు డిక్రీజ్ ద రిస్క్ ఆఫ్ స్కిన్ క్యాన్సర్ అండ్ ఆల్సో సన్ బర్న్ లైక్ స్కిన్ రియాక్షన్స్, సో దట్ ఈస్ సన్ సెన్సిటివిటీ కాజ్డ్ బై సమ్ మెడికేషన్స్ ఇంక్లూడింగ్ టెట్రాసైక్లిన్స్, సల్ఫర్ డ్రగ్స్ అండ్ phenothiazines such as chlorpromazines. సో ఇక్కడ ఏమవుతుంది మనకు when the sunlight when the skin is continuously exposed to the skin, there is a chance of getting skin cancer. ఇందుకు అల్ట్రావైలెట్ రేస్ ఎక్కువ ఉంటాయి కదా, సో అది ప్రివెంట్ చేస్తుంది. అందుకనే సన్ స్క్రీన్స్లో రాసుకొని ఎండకు పోయినప్పుడు ఇట్ ప్రొటెక్ట్స్ ద స్కిన్. The active ingredient in sunscreens work either by absorbing the sun's ultraviolet, that is UV radiation, preventing it from reaching the deeper layers of skin, or by reflecting the radiation. Next comes classification of sunscreens. కొంచెం పెద్దగా ఉందమ్మా, that's why I will just move. The last sunscreen monograph, that's okay. Then classification chemical and physical, that is chemical is organic, physical is inorganic. Local వచ్చేసి organic, inorganic and systemic. Local and systemic, chemical and physical. There are two types of classifications. Organic sunscreens, that is chemical sunscreens. Organic ultraviolet filters are active ingredients that absorbs UV radiation within the particular range of wavelengths and depending on their chemical structures. Use of UV filters absorbs the energy. It moves from a low energy ground and state to high energy existed state. And next, organic sunscreens, UVB filters are there, power derivatives are there, and cinnamates are there, salicylates like octisalicylate, homosalicylates, then octosalicylates and ensilizole. These are the ultraviolet rays filters. Then this is continued, benzophenes are there, oxobenzones are there. These are the different types of combinations they use in creams. Then broad spectrum combinations, that is UVA and UV. These are the different types of ultraviolets. So Kemsul ఒకటి, then silatrazole, then bemetazole and bisoctrizole. Okay, then tinozopium, this is more helpful. This is the combination of organic plus inorganic and also UVA and UVB. This is hybrid broad spectrum sunscreen. Then inorganic, that is physical sunscreens. Organic అయిపోయింది కదా, next inorganic. Zinc oxide, titanium dioxide, these will be used in preparation of inorganic sunscreens. Others are iron oxide, petrolatums, then cholins, then calamines, then istamols. That istamol is aluminum bitumenosulfate. Then talc is this application. Then inorganic agents function by reflecting, then scattering or UV radiations. ఓకే, రిఫ్లెక్ట్ అన్నా చేస్తుంది, లేకపోతే వాటిని స్కాటర్ చేసేస్తాయి. సో స్కిన్ మీద డైరెక్ట్గా రాకుండా చేస్తుంది, ఓపెక్గా ఫామ్ అవుతుంది. Then their opaque nature and whitening effect are an inherent disadvantage, which may be minimized by use of micronized or ultrafine particles. నెక్స్ట్ వచ్చేసి సన్ స్క్రీన్ పీల్స్ ఉన్నాయి. పీల్స్ అంటే తెలుసు కదా, ఒక లేయర్గా వేస్తారు, తర్వాత ఇంటికి ఎక్స్పోజ్ అయిన తర్వాత ఒక ఆఫ్టర్ ఫ్యూ అవర్స్ దట్ విల్ బి జస్ట్ రిమూవ్డ్, పీలింగ్ ఆఫ్ అంటారు కదా, మనం పైన తోలు తీసినట్టుగా అదే దాన్ని పీల్ ఆఫ్ చేస్తారు. So here Jesna solution with Resorcinol. Resorcinol వచ్చేసి 14 grams ఉంటుంది, సల్ఫ్యూరిక్ యాసిడ్ 14 grams ఉంటుంది, లాక్టిక్ యాసిడ్ వచ్చేసి 14 grams ఉంటుంది, అన్నీ ఈక్వల్గా ఉన్నాయి. ఎథనాల్ అప్రాక్సిమేట్గా 100 mlకి ఎంత అవసరమో అంతనే కలుపుతారు. దెన్ సిస్టమిక్ ఫోటో ప్రొటెక్టర్స్, ఇవి వచ్చేసి బీటా కెరటిన్ ఆర్ రెటినాల్ ఆర్ ascorbic acid ఆర్ ఆల్ఫా టోకోఫెరాల్స్. దెన్ సెలీనియం ఆర్ పాపా. Then antihistamines, aspirin and indomethacin, and then corticosteroids. So there may be the combination of these different chemicals. Then ఇది మీకు అవసరం లేదులమ్మా. The next comes antimicrobials. So the most common skin infections మీకు తెలుసు డీటెయిల్గా తెలుసు antimicrobials. So just I will give you a read. The most common skin infections are caused by Staphylococcus aureus, group A Streptococcus or other normal skin flora. The anti-staphylococcal oral antibiotic is preferred treatment for non-bullous or bullous impetigo, and a new therapeutic agent that is effective against both Staphylococcus aureus and these streptococci is appropriate for the most cases of cellulitis. So cellulitis is mostly caused by these streptococci. For furuncles and carbuncles, cutaneous abscesses and inflamed epidermolysis, and the most important therapy is incision and drainage. For all these they use incision and drainage because there is infection. And in most cases there is no need of antimicrobial therapy. Patients with venous ulcers and atopic eczema do not benefit from systemic antimicrobial therapy, so they will not be advised or prescribed antimicrobial treatment unless obvious infection is present, as indicated by clinical features such as fever, cellulitis and lymphangitis. Unless until these clinical symptoms appear, it is no need to give antimicrobials. An anti-staphylococcal oral antibiotic is preferred treatment for non-bullous and bullous impetigo and a therapeutic agent, and that is effective against both staphylococci and streptococci, and it is more appropriate for the most cases of cellulitis. Okay. So the topical antibiotics are fustic acid cream or ointment, or miprocin ointment, that is 2%, 15 grams tube that is available. Then the topical antiseptics are hydrogen peroxide cream, poured in iodine ointment 10%, and other topical antibiotics are also available for acne and for infections of eye, nose, ears, and including fustic acid as an eye gel. These compound preparations, example fustic acid plus betamethasone valerate and hydrocortisone plus natacin and neomycin. So when you take these creams any time, just have a look whether what is the combinations, what is the concentrations, what is the weight of that molecule, ఇవన్నీ కూడా మీరు చూడాల్సి వస్తుంది. ఇప్పుడు మీకు ఒక ఐడియా వచ్చింటుంది స్కిన్ ఆయింట్మెంట్స్ అంటే ఏమేమి ఉండొచ్చు, ఎలా ఉండొచ్చు అనేది. Then comes antibacterial agents. These topical corticosteroids do not inhibit the effects of co-administered antibiotics. In the treatment of secondarily infected dermatitis, combination therapy is very much required. Then antibiotic corticosteroid combinations are useful in diapodermatitis, otitis externa, and impetigo or impetiginized eczema. That is one type of eczema. Then the pathogens in surgical wounds are those resident in the environment, so information about regional drug resistance is very important. Bacitracin and gramcidin. Bacitracin and gramcidin are the peptide antibiotics active against gram-positive organisms such as streptococci, pneumococci, and staphylococci. These are the gram-positive. Then most anaerobic cocci, Neisseria, tetanus bacilli, and diphtheria bacilli are also sensitive. So for them also, for these bacteria, this can be used. Bacteriocin is compounded in an ointment base alone or in combination with neomycin, polymycin B, or both. Bacteriomycin is poorly absorbed through the skin, so systemic toxicity is rare, but allergic contact dermatitis is very frequent. Then polymyxin B, neomycin, and gentamicin. Polymyxin B is a peptide antibiotic effective agent and a gram-negative organism. All these gram-positive organisms are resistant. Then neomycin and gentamicin are active against gram-negative organisms. These gentamicin generally show greater activity against neomycin. Neomycin causes sensitization, particularly in eczematous dermatitis or if compound in an ointment vehicle. So next comes antifungal agents. So these antifungal agents includes topical antifungal agents like topical imidazoles, nystatins, and oral antifungal agents like oral azoles and griseofulvin agents. Then glucocorticoids. Glucocorticoids depress the local defense mechanism of the skin, and for this reason must not be used in skin infections, in true pathogenic microbial infections. In infected inflammatory skin lesions, when there is a saprophytic infection of the skin, then these glucocorticoids may be applied with good result. Corticosteroids are the hormones, are naturally occurring hormones produced by the adrenal glands within the body. Topical corticosteroids, so already our body produces these corticosteroids. These topical corticosteroids are synthetic corticosteroid medications, and they are used to treat skin conditions like rashes, dermatitis, itching, eczema, and psoriasis. These topical corticosteroids have potent anti-inflammatory actions and also suppress the immune responses. And these topical corticosteroids are based on their property, the area of the body to which they are supposed to be applied, and the type of skin conditions being treated. Based on this, these corticosteroids will be used. So these they are grouped as based on this potency. They are grouped very high potency and high potency, and then medium potency and low potency. We will discuss about very high potency. They are beta methazones, dipropionate, then clopidogrel propionate, then difluoroazone diacetate, then fluosinonide, and halobestol propionate. High potency desoxymethasone and then amsinoid. Medium potency beta methazone valentrate, clocartolone pivalate, fluconol acetonate, fluorine, fluconate, then prednicarbate. Then low potency alclometazone dipropriate, desonite, and hydrocortisone. The topical corticosteroids are available in the form of creams, ointments, gels, solutions, lotions, foams, sprays, shampoos, oils, and also pads. Then coming to the acne. Acne vulgaris తెలుసు కదా మొటిమలు అంటారు. So acne vulgaris is one of the most common skin disorders which dermatologists have to treat. It mainly affects the adolescent though many present at any age. In later ages also it comes, but very common in adolescents. Acne by definition is a multifactorial chronic inflammatory disease of pilosebaceous units. Acne face washes are often contain salicylic acid, which removes the oil and clears the pores. If you have sensitive skin and find foaming of face wash or other gentle cleansers labeled sensitive. The topical medications that are available for acne are retinoids and retinoid like drugs. They are available in the form of creams, gels, and lotions. So these retinoid drugs are derived from vitamin A and they include tretinoin. and tazarotene. This medication can be applied in the evening, and these and they works by preventing the plugging of the hair follicles. Then next comes antibiotics. These works by killing excessive skin bacteria and reducing the redness. For the first few months of the treatment, you may use both retinoid and antibiotic also. These antibiotic can be applied in the morning and evening.